Hi, everyone. Thank you for joining us today. My name is Vivian Frosto, and I am an Events and Programs Manager at the Seattle Chamber. I'm excited today to bring you our Executive Speaker Series. Today, we're going to be recording and chatting with 4 experts in the field. We will be talking about the Regence healthcare industry, including the successes, challenges, and opportunities our leaders have seen in recent years. Before we get started, I would like to thank our sponsors, Advanced Professionals Insurance and Benefits Solutions, as well as Business Health Trust. Nathan Edmondson is kindly joining us from Advanced Professionals today, and I will turn it over to you, Nathan, for a few remarks.
Thank you, Vivian. I appreciate it. And as someone who's attended this event series over the years, I think this is a great opportunity for people within the region to hear directly from experts in their field. And I'm excited to hear from the panel, so I'll keep my remarks short. But I'm with Advanced Professionals Insurance and Benefit Solutions. And what we do is we manage small employee benefit programs. Specifically, we support the Business Health Trust, as you can see on the slide here. And our goal is to make health insurance packages available that are affordable and comprehensive and meet small employers' business needs as they grow their business and navigate through what can be a very challenging landscape in securing quality health insurance for their employees. Something we take great pride in, both within the region and the state of Washington at large, and really appreciate the opportunity to work hand in hand with the Chamber of Commerce to bring forward solutions for small businesses who are frankly an underserved market segment, within the state of Washington. So we love to be a resource for everyone out there that is interested in hearing more or learning more about health benefits for their employees, questions or opportunities maybe for us to provide you a solution. We are here to support you and help you. So if you're a small business interested in learning more, please contact us or the Chamber. We've been serving the Chamber for over 15 years, so it's a very great relationship. We work hand in hand together, and we really have that common goal of serving that small business community. So thanks again to the Chamber for hosting this event series. It is a great one. I look forward to hearing the speakers. And again, if we can be a resource for anyone in the audience today, please do not hesitate to contact us. Thanks very much again. And Vivian, I'll turn it back to you and on with the show.
All right. Thank you so much, Nathan.
Yes.
And thank you to our sponsors. Our programming would not be possible without all of you. All right, so now we are going to dive right into our panel on healthcare. You are all welcome to turn on your videos. Thank you again so much for joining us today. I know that healthcare has been front and center the past few years, and people are always interested to learn more. I'm going to begin by introducing Claire Verity, the president of Regence BlueShield. As the Washington Market President, Claire is responsible for creating a strategic vision for Regence in Washington that is grounded in partnerships, collaboration, health equity, and growth. She directs the statewide operations of Regence, including sales, provider contracting, government affairs, and community relations. Regence serves over 2.1 million members. Claire brings her strategic vision and transformational leadership to Washington. During more than 2 decades in the industry, Claire has a record of leading innovative solutions and has been on the cutting edge of new member and employer advocacy models. Her critical thinking, relationship building, and advocacy bridges her passion and commitment to improving health equity. Claire has a deep understanding of how to transform the healthcare experience and has engaged in local, regional, and national efforts to reduce health disparities and improve health engagement. Before coming to Regence, she was president and CEO of a national health plan in the Pacific Northwest. In addition, she served as a national leader on developing and implementing innovative consumer engagement solutions that resulted in increased engagement, simplicity, satisfaction, and outcomes for members as they progress through their health journey. Thank you so much for moderating our conversation today, Claire. I am going to hand the mic over to you to kick off our panel by telling us a bit about the healthcare industry, Regence BlueShield, and our speakers today.
Great, thanks Vivian, and thanks Nathan for those opening remarks as well. So as you heard, I'm Claire Verity, I'm Market President for Regence BlueShield here in the state of Washington. Regence, if you did not know this, has a very long legacy here in Washington. We've been here for more than 100 years. And a century later, our mission remains centered around service. We serve nearly 1.5 million members here locally in the state, and we stay focused on making that healthcare experience better and more affordable. And you're going to hear some of those themes, I think, with some of the colleagues that are going to be speaking in just a moment. We'll talk about what's happening here in Washington in healthcare, the challenges, the opportunities brought on, whether it's the pandemic, the economic headwinds, and certainly some bright spots around technological changes that I think are facilitating some important changes with our healthcare experience. Providers around the state are facing different challenges, everything from staff burnout to early retirements. And at Regence, we want to continue to work. You heard the word collaboration. We really want to work in a collaborative environment with providers to continue to find ways to use technology to make it easier for both provider and members to navigate the healthcare system. We want to make sure as well, over the last few years, you might be hearing, and you'll hear a few comments, I'm sure today, around patients or our members maybe avoiding some care that they should be getting. And we certainly are working very hard with our provider partners to ensure that people aren't postponing or abandoning preventive care, which we know leads to worse health outcomes, higher claims, and a higher cost of care. Telehealth is booming. We talked about technology. We alone saw a 500% increase in telehealth, but not everybody on the health equity scale has the same access. So telehealth, while great, can't be the sole solution for everybody. Behavioral health has soared, the need for that. We've heard that on a local, regional, and national level. We continue to find ways to increase access to behavioral health care, making sure that the resources, whether they're telephonic or in person, are known and available to our members. The one piece that I always go back to, though, and it brings me back to why we're here, our healthcare system continues to become more expensive and inefficient. The healthcare spending in the U.S. was expected to reach about $4 trillion in 2020 and will reach around $6.2 trillion by 2028. That's almost about 20% of our gross domestic product will be attributed to healthcare spend. But with all of that, the U.S. health system is still ranked the worst healthcare system overall among the 11 high-income countries, according to Commonwealth Fund. So we've got some work to do on that front. But certainly, I think the panel here of experts will shed some light on what we can do to increase equity and access to the healthcare that we all need. We need to make the healthcare system work better for Washingtonians and their families. This transformation doesn't happen overnight. And I think it's exactly what the system needs to make healthcare more affordable and more effective. So a lot of work to do, a lot of good work done, more work to do as we move forward. So I'm going to introduce our panel. I'm just super excited. These folks are extremely some of the best in the industry, have some really good insights to share. I'll start with Brittany, Dr. Brittany McCreery with Fred Hutchinson Cancer Center. Brittany is the Vice President of Quality, Safety, and Value for Fred Hutchinson Cancer Center. In her role at Fred Hutch, she has oversight of patient safety, quality, and improvement, patient experience, accreditation, regulatory affairs, and clinical laboratories and cellular therapeutics quality assurance, encompassing the inpatient hospital unit and 7 ambulatory sites of care throughout the greater Puget Sound. That is a lot. Prior to serving in her quality leadership role, she spent 6 years leading the physician and medical practice for Seattle Cancer Care Alliance, which is now part of the Fred Hutch Cancer Center. Next, we have Dr. Arooj Simmonds with Swedish Health Services, excuse me. Dr. Simmonds is the Chief Medical Officer of the Puget Sound region, covering North Central Seattle and South Puget Sound for the Providence St. Joseph Hospital System. In January 2023, she will become the Chief Medical Officer for the North Division of Providence St. Joe's Health System, representing Alaska region and the Puget Sound region from Everett to Centralia. Prior to her CMO role, Dr. Simmonds was the Executive Medical Director of Surgical Services for the Swedish Health System. She completed her residency in anesthesia at Virginia Mason Medical Center and her cardiothoracic fellowship at Duke School of Medicine. She is currently completing her MBA at the University of Washington in Seattle. And then we have Dr. Geoff Ankeney with Kaiser Permanente. Dr. Ankeney serves as the statewide medical director for Kaiser Permanente's Washington commercial business. In this role, Dr. Ankeney works closely with the medical leaders in sales to strategize and execute plans to support commercial membership. Dr. Ankeney joined Kaiser Permanente in Washington in 2017 as a primary care clinician at the Olympia Medical Center, where he continues to practice as a family medicine physician. So a lot of very accomplished individuals joining us today. So very excited about that. So I think we're going to move into the panel discussion next. So I think the first question is really to describe your organization, how you fit into the region's healthcare ecosystem. And I think we can start that off with maybe with Dr. McCreery starting first.
Sure. So thanks, Claire, for the introduction. And just to delve a little bit more, for those of you who don't know, Fred Hutchinson Cancer Center is a nonprofit adult cancer care and research organization, and we are also the cancer program for UW-Medicine. We're relatively new in some ways because we just recently completed a merger between Seattle Cancer Care Alliance and Fred Hutch Cancer Research Center to form the Fred Hutch Cancer Center, really to help us take our integrated research and clinical program further in our ability to discover new cures for cancer, as well as some of the world's deadliest diseases such as HIV and now COVID-19, and make life beyond cancer a reality for our patients, both those that we treat and how do we also take best practices regionally and nationally. We were the first National Cancer Institute designated comprehensive cancer center in the Pacific Northwest, and we are recognized as a global leader, particularly in bone marrow transplantation, immunotherapy. It really highlights to the program and the cancer care we deliver. And I think, as you mentioned, we have, I think, 8 total sites across the Puget Sound, and that includes our main campus for research and ambulatory care in South Lake Union.
Wonderful. Thank you very much. Next, I'll ask Dr. Simmonds to make a few comments to the question about, describing your organization, how you fit into the region's healthcare ecosystem.
Yeah, absolutely. Thanks for having me. So Providence Swedish are 8 hospitals under the Providence umbrella that span from Everett down to Centralia. So we have 8 hospitals caring for about 1,000 unique patient admissions a year. So really serving our community up and down that I-5 corridor. Doing that, we do it with about 22,000 caregivers. So also supporting our large population of workers in our area. And aside from our hospitals, we have freestanding clinics, thousands of physicians providing everything from having a baby to end-of-life care. And so we're pretty embedded in the communities that we care for.
Thank you very much. And I don't know where you find the time in your day to do all the things that you're doing. Congratulations to you on that. All right, next I'll have Dr. Ankeney give a few comments to that question about Kaiser Permanente's organization and how you fit into the region's healthcare ecosystem.
Thank you. Well, so Kaiser Permanente we call ourselves an integrated healthcare and coverage organization because the care and the insurance coverage are both part of the same system. And we serve more than 650,000 members in Washington state. We have more than 30 locations scattered across the state, as well as 5 specialty centers. The goal of KP is to provide high quality, affordable healthcare services for both primary and specialty care. The integrated care and coverage model that we employ helps us build a collaborative relationship with our patients. And it really reduces inefficiencies and redundancies because we're coming together from both directions. In addition to improving the health of our members, we're also working to improve the health of the communities we serve through various endeavors where we're involved with the communities of Washington as well. So that would be KP in a nutshell.
Thank you very much. You're also, all 3 of you are very busy, I know. It's been an interesting few years that we're coming off of. So we have a question here, and everybody will have a chance to weigh in, but we're going to start with Dr. Simmonds on this one, which is, what is the biggest challenge to the industry right now?
That's an easy one. I can almost answer it with one word, which is staffing, right? So healthcare has been unbelievably challenged and stressed over the past almost 3 years for healthcare workers and for health systems and any healthcare delivery. But having enough nurses or techs or case management, really any of the professionals that care for our communities is our issue. And this is national, it's not unique to the Puget Sound. The cost of living in the Puget Sound probably exacerbates our crisis. And it's impacting everybody. I think all 3 of us on this call, from clinics to urgent cares to EDs to our hospitals, and then things that you don't think about. The nursing homes are struggling to staff, home health agencies. How we deliver care across the care continuum without the workers is impacting everybody, and it's a cycle, right? So right now, for example, pediatric RSV is everywhere, and our pediatric resources are beyond stretched, and that's in the setting of a healthcare worker crisis. So it's stressing an already stressed system. So it's something that I spend day in, day out talking about, trying to come up with creative ideas. We're working on the obvious. How do we retain our workers that we have? How do we make coming to work for us or coming to work as a healthcare worker something that people want to do? How do we recruit more workers? And then how do we reimagine how we deliver care? And I think that's the biggest part of this discussion, and really how everyone's going to move forward, is we have to evaluate care at every level and reimagine it. And some of it is, Claire, you talked a little bit about, is focusing on where we provide care, focusing on primary care, and just reimagining all of it. And not one system or one person's going to have these answers. It's how do we collaborate, whether it's the WISHA or other organizations, to really get us enough healthcare workers to care for our population.
And Dr. Ankeney and Dr. McCreery, you may have some additional comments to add to those as well. To that question about our more immediate need as far as the biggest challenge right now.
Yeah, I think it's hard to say anything really beats staffing right now for anybody in the region and nationally. You know, healthcare already had a bit of a burnout problem prior to COVID-19. And I think maybe our lack of addressing some of those things prior to 2019, 2020 really caught up with us during the pandemic. And so, you know, I think the other piece is really then, you know, how does that staffing impact the rest of the care? So I love what Dr. Simmonds said around how do we reimagine care. Certainly from my hat in quality, we know quality and safety is very tightly linked to how robust our staffing is in our systems. And so I thinking about how do we develop additional systems around the staffing levels we do have. Even in the future, we were already predicting to have shortfalls in nursing and physicians over the long term. And so really building new systems, I think, and how we deliver care is going to be a challenge for our industry.
One thing that probably bears mentioning is that I think from an operational standpoint, the pandemic really isn't over for us, at least in this industry. So sure, there are a lot less strictures that we see on a statewide level and a national level, and the CDC has pulled back guidelines dramatically. But as far as the systems themselves, we're still struggling with basically we're still trying to emerge from the pandemic. It just probably doesn't look that way to a lot of especially patients. An example is that many particularly emergency rooms had to let staff go, and also even private clinics all across the state and the country. There was a massive change in income, and there wasn't the ability to support the staff financially the way they were previously. And now that a lot of that is coming back online, we're seeing more patients and getting back to normal, so to speak. Many places are now trying to find the staff that they had to let go. So there's difficulty on many levels. Probably the good news from this is that it is driving some creative thinking in how best to approach the problem and what sort of opportunities this presents going forward.
Thank you. I think on this topic, because it is a very not only real challenge to each of your organizations, but to many others, and we hear it in the news a lot. This is not a is not a surprise to many. So I think the word I heard at the very beginning, I think too, is how are your organizations, as we think about staffing, reimagining the delivery of care? So maybe it was originally, you come through the emergency department, you go to your primary care office, but now there are options of, can we do something more in-home care? Can we do other alternatives? Obviously, technology is playing a big part in that, both for behavioral health and even physical health, as far as accessing care. So I guess the question, if just for a minute or two each, how are you addressing the staffing concerns that your organizations are facing? And I'll go in reverse order. Geoff, I'll start with you first, and then we'll go backwards.
Well, it's been fun to watch for me as a provider on this front, just because the pandemic really drove what was probably an underwhelming already or under support for the digital, basically, revolution of healthcare provision. And we hadn't really, even opened that box or those possibilities. But the pandemic really fast forwarded that. I think we were headed in that direction anyway, but with the pandemic, we had to really force the issue, or we'll say that the pandemic really forced our hand, so to speak. And at least at Kaiser, we've been really well positioned. I was surprised at how much software was in place, standardization was in place, patient privacy capabilities had already been put in place. And I think that is playing out in other groups as well across the state and the country. But that was probably has been one of the best things to come out of the pandemic. There weren't many good bright spots, but I would say that might be one, is that the delivery of healthcare in America has changed, and we're never going back. There will always be this a broader, more diverse capability for delivering healthcare than there ever was before. And it's helping in the short term with the shortfall in staffing, but in the long term, I think more people across a wider spectrum of races, genders, the underserved, are going to start receiving healthcare because we're learning how to deliver it in a way that is new and more accessible to a greater number of people.
Agree. Dr. McCreery, do you have a couple of comments to add on that?
Yeah, I think, for us, we're actually getting ready to open a new tower on our South Lake Union campus. It's going to almost double our square footage. And the design of that space, although granted it started before the pandemic, is really different from a kind of traditional clinic where, your provider workroom and your nurses and your schedulers are kind of separated. The rooms are kind of hidden and cubbied away, and to what we're calling a care neighborhood format. And I think other systems in our region have used something similar, but it's really the concept there is then how do we bring the patients to have visible line of sight care to their teams, and how the space is arranged, and then how do you actually staff that space differently and in a more efficient way? Because when those team members are sitting in a teams-based environment where they can communicate in real time, you take a lot of inefficiencies out of the system. And then it's given us an opportunity to really look at role design and say, how do we get the right tasks into the right roles? So how do we free up our nurses from doing administrative tasks that can live in other parts of or other roles in the organization? How can we take some of those administrative tasks and automate them for those roles? And so it's really making us think about that role design so that people are functioning kind of we say like top of license for their scope and staying engaged and I think enjoying the work that they're doing so that they view a long-term career in healthcare. So I think that's been really important for us.
And Dr. Simmonds?
Well, I'm along the similar lines, right? So it's reimagining how we give care, because the telemedicine plus of COVID has been huge, realizing that we can provide care, but also at the same time realizing that we have the same amount of nurses and doctors and caregivers. So when we expand into the virtual platform, we're losing in-person teams to help care for our patients. So how do we use that to still care for the patients that have to be in a hospital? And something we have done is we have a transfer and operations center that helps coordinate care between our 8 hospitals and outlying hospitals. And in there, we've embedded case management assistants and some nurses to help the bedside nurse get a patient home faster, work on all that kind of not busy work because it's integral to the care of a patient, but the day-to-day tasks that interfere with direct patient care. So we're lightening the load of the bedside nurse with this virtual nurse to help get care delivered to our patients, right? If someone needs an MRI and that's what's waiting between going home, let's see if someone else can call and coordinate that instead of the nurse that's caring for the patient. So we're trying to leverage our transfer and operations center to help improve everyone's care and lighten the burden of our nurses and techs.
Wonderful. I love the words I think each of you used, which is how do we continue to leverage the change that was thrust upon us from a technology perspective? Because some people might say technology is great, but it can also have its dark side, I guess, if you will. But I love the notion of working at the top of the license, making sure that the people who are practitioners are able to practice medicine as opposed to maybe some other things that maybe another person in a different license or whether it's a medical assistant or whomever can take on that burden. So it kind of disperses that impact a little bit. And I love the notion that delivery has changed. The delivery of care has changed forever. There's no going back to the way it was. There will be portions, I'm sure, of that, but just as a person, a consumer myself of the healthcare system, we need to start operating a little different as we move through the next handful of years. So thank you. I appreciate those comments. Okay, so here's the next interesting topic and question for us to tackle today. And this is going to start with Dr. McCreery, if you wouldn't mind taking this one. But as we look ahead from here, what opportunities do you see for the healthcare sector to grow or change? We may have talked a little bit about this, but what do you expect and what do you hope to see?
have done mute myself. Yeah, so I think building on our discussion around technology already, we've been saying you can't put the genie back in the bottle on telehealth. And I think particularly what was exciting, I guess, if you can find the silver linings, you know, for subspecialty providers like oncology, our primary care colleagues had already had us a beat, I think, in getting to telehealth in many ways. And so it really forced us to move much faster in that direction, to continue to meet the needs of our patients who maybe we didn't feel comfortable bringing on site, particularly in a very immunocompromised population early on in the pandemic. And what we've really seen telehealth help us with is all of that comprehensive wraparound care for patients. So that way they don't have to travel back to South Lake Union and fight the traffic or cross the mountains for things like their nutrition, their palliative care, psych evaluations, kind of all of those other supporting aspects that are so important to adhering to their treatment and having a positive outcome. Telehealth has helped us with dramatically. And when we think about functioning across 8 sites of care, getting more level loaded, I think, those services across those sites. So I think the risk there, though, is that on the federal level, we're still under a temporary state for a telehealth reimbursement. And so my hope is that we're going to see Congress come together to come up with a permanent solution for telehealth reimbursement. And thankfully at the state level here in Washington, I think we're maybe a little ahead there, but we definitely need a long-term federal solution. I think similarly, you had actually touched on, Claire, the ability to drive more care into the home. And so we haven't done this at Hutch, but certainly other centers regionally and then other cancer centers throughout the nation have done a lot more like hospital at home care, which again is offered under a temporary waiver. But that's actually not it might be considered new to us, but it's a long-standing, decades-old practice that has been shown to reduce cost of care that we just haven't adopted here because we don't have the payment incentives, I think, to do so. And so again, hoping that we'll see the federal side has kind of paved the way here for us to do more creative things, both locally and nationally in healthcare. And I think I heard recently that Washington State is one of the states furthest behind in inpatient bed capacity relative to the population. And I think we're expecting another 1 million residents here in 10 more years. And so we're going to see a lot of pressure on inpatient bed capacity and how we can drive more and more care into the home. So I think those will be really exciting things that we'll hope to see in the future. I think the other piece, if we can put the pandemic and technology aside for a minute, and I think we're going to go into this a little bit more, is really the huge explosion, I would say, in the focus on health equity and health disparities over the last couple of years. And I expect to see a lot more public discussion on how we are sharing data on this as healthcare centers and having accountability to meeting more needs of the populations in our region. Washington State Department of Health is putting out some new requirements. We see places like the Joint Commission, which accredit hospitals having a new health equity accreditation program. And so a lot of energy here. And so I see us and our Washington State Hospital Association actually brought many hospitals together to do some growth and learning together on health equity. So I see a lot more data, a lot more programs coming out in the future to help us reach underrepresented populations. And then, at our center, we're excited about that because we think addressing those barriers to care and addressing those disparities will also help us identify pathways to get better representation in clinical trials. And, that's so important in not only recruiting representative populations, but also designing trials in a way that actually helps us understand how we can better serve the diverse community we have. So I think there's a lot of exciting things that will come for the years ahead.
Wonderful, thank you. I'll have one comment to add. You mentioned something that's really intriguing to me, but Dr. Simmonds, anything to add? Do you want to focus anything on maybe primary care in this body of the question?
Yeah, so Dr. McCreery hit that. That was perfect, right? So much of that is what we need. Primary care is the other big focus. Right now, when you talk about everyone being stressed, ED waits, patients need more access to primary care. And I've talked to some patients and they said, well, it takes me 3 months to make a new appointment as an unestablished patient with primary care. say do it now, right? Because once you're established with a primary care physician, getting those follow-up appointments when, I always use the example of one of my kids, when I knew she'd sprained her finger or broke her finger, I didn't take her to the urgent care or to the ED. And granted, I have them a little biased because I'm a physician, but I called her primary care doctor. They had an appointment same day, and I brought her in. They did everything. It made our life easier, and it didn't clog up the emergency rooms, right? So for me, if you have a primary care and if you have a simple ailment, call them and make an appointment. And if you don't have a primary care and you're listening to this, go find one. And that will help the healthcare system, and also just help create healthier individuals in our population. And so to me, that shift back to primary care is essential.
I love those words. I think the return to the primary care, I think we stepped away from that in the industry for a while, and it was kind of free access to anybody and everybody. And I think we're coming back to the need for that primary care to be the center of our, of our base, basically, to help us navigate a little bit more efficiently. Dr. Ankeney, what about, as we think about the comments, and you can add some commentary of your own to the question, but what about advances in technology and what do you, I mean, you talked a little bit already about this, but what would you add to, what do you expect and what do you hope to see?
Well, I was just going to mention on the just to back up a little bit on the opportunities that have come through or that we're looking at in the future. One thing I've found is that maybe another silver lining to the pandemic has been that healthcare as an industry kind of came out looking pretty good. In other words, a lot of people understand that or kind of regard especially primary care, especially those on the front lines, as having really put their lives on the line to try to help the people who are suffering from the pandemic. And as a result, when we talk about understaffing and we talk about how we're trying to find more people to share the burden now, I'm thinking of, I precept medical students from University of Washington, and my latest med student, I always hesitate to ask what specialty do you want to go in, because they usually historically have always said, some specialty. And I'm always hoping as a primary care doctor that they would say primary care. And this last one specifically said that. He said, I want to go into primary care, either pediatrics or family medicine. And the reason is because these were the heroes that stopped the pandemic. They were the ones on the front line, and I want to be there to, pick up the torch. And I think we're seeing that across everyone. I'm hearing my patients say a lot, you guys were there for us. I know the wait is longer, but you've been there for us. So the opportunity here is to capitalize on that and to continue to fill the ranks, particularly at the primary care level. When you're talking about the digital revolution and the virtual care that's occurring, it's true. Brittany brought it up already, I think, but what is being driven is a new sense of creativity that's coming from let's move away from this idea that you as a patient need to get into your car and drive to a place and find parking and then wait in a room and read outdated magazines and then eventually get called into the back room somewhere. And then a lot of things will happen before you finally see your provider who's in a big hurry and hopefully gives you the time that you'd like. Those days are gone. And what is being put in place there isn't just virtual care in terms of doctor visits alone, but all kinds of things. Brittany brought up home or hospital at home. The hospital down here, St. Pete's, has just started it. Kaiser Permanente has also just started a hospital at home program. And this is not home health care. This is a hospital bed in your house. And the care is being delivered, hospital level care is being delivered to you in your house. Totally new idea in our system. Brittany also brought it up. It's international. It's been in, I think, Belgium and the Netherlands for the past 20 years or something, but it's very cool to us. So we're really excited about it. there's consulting nurse services, there's care chat services where you can chat back and forth with an actual provider who has prescribing capabilities, and you don't even have to leave your room. I've had patients when I've done care chat talk to me on their phone. They're a passenger in a car and they're driving and getting their healthcare as they're driving to somewhere else. So the digital revolution is a good thing. I think it's decompressing the number of patients that are crowding into the emergency rooms and waiting rooms, and it's diversifying those who can receive healthcare, as well as inspiring a second generation to come behind us and start picking up the torch, which I think we're going to see over in the near term.
I agree on that. I think it also goes back to making sure that the new way is also fairly reimbursed and compensated to practitioners. I had a personal experience with a primary physician a few years ago and doing a lot of work just on email, right? Going back and forth between their patient population, and they're spending a quarter of their time a day on this type of care delivery, yet no reimbursement for it, right? So I think that goes back to the earlier conversation about how we might be able to facilitate ongoing reimbursement on different deliveries of care models than we've been used to in the past. So fingers crossed that that'll become just a kind of a standard way we think about it. All right, well, thank you. Great. Gosh, I'm taking a lot of notes here because some really good comments. The next question is around equity, and we've kind of touched a little bit on edges of this, but equity and access to opportunity for underrepresented communities in the BIPOC community is a crucial piece of our recovery. The pandemic, unfortunately, exposed a lot more disparities, whether it was individuals who contracted COVID, who became sicker than others, whether it's the Black and Brown community or others. So I'm kind of curious how you are including this community and how can this change the industry? And I'm going to have Dr. Ankeney start on this one first, and we'll go back to the others.
Well, I think it has become increasingly clear in the past maybe couple of years at least that diversity is an absolute essential in the provision of healthcare and as well in the workforce that provides that healthcare. Having a diverse and also inclusive workforce, it's what makes, we believe at Kaiser anyway, it makes us a better place to deliver healthcare and also a better place to receive healthcare, particularly because as we diversify our workforce and work to do that, the provision of healthcare is better reflecting the patients who are also receiving the care. We know as well that there's a lot of facets to this, and it's been interesting to see how many different ways people or organizations are trying to address the issue. We know, for example, that total health goes beyond the doctor's office, and in fact, the care of a patient in the doctor's office model alone often is part of the one of the bigger reasons why people from the BIPOC community, we'll call them, are left out, because that's actually a cultural development and it isn't necessarily universal. And so understanding where those disparities are, recognizing why we have them, and then trying to address those is absolutely essential. So Kaiser is working on trying to address social drivers of health inequity as well as in-office drivers. And one thing that I've seen in our organization, I think I've seen it in a couple others as well, is not, we're kind of beyond the point where we have defined that there are disparities in health between certain people groups and others. There are gaps, and we've gotten beyond making that argument. I think that that's a foregone conclusion now. And so the bigger question becomes, well, why? Because once we figure out why, we're able to then better address that question. Because it becomes complicated sometimes why, and sometimes the answers are quite clear. One thing I noticed recently is just kind of a fun anecdotal story is the idea of wound care in the hospital setting. And it was yet another identified disparity between basically white patients and Black or African-American patients. The wound care outcomes were poor among African-Americans. That data is unassailable. It's there. It's clear. What I appreciated is that then there was a second study put into place to address the question why, because there was it was identified that providers of any race and any gender were providing an equal differential in care between one race and the other. And so the question was, what's happening? Why is that happening? And it's this emphasis on EID, this emphasis on equity and inclusion that is driving people to ask more in-depth questions about why is that happening, so that we can figure out, well, what then should we do about it? And in this particular case, it was identified that basically wounds, as they're becoming infected, are harder to see on skin that has more melanin, that's darker. And so the training itself, we talk about systemic racism. I'm not sure that that's as accurate as calling it systemic race ignorance, perhaps, but the training is insufficient for recognizing wounds getting bad as time progresses in different skin types and different skin tones. So those are the kind of examples that I'm excited to see moving forward.
I saw that study as well. That was interesting. I will pass it over to Dr. Simmonds. If you've got some added commentary in this area, I know this is a rich area of conversation that probably could last a couple of days, but if you've got a couple of comments, that'd be great.
I do, and I agree with Dr. Ankeney. So there's different parts of it, right? There's the diversity of our workforce and our physicians. And then there's the health equity portion of it. And so something our health system has done is in late 2020, we hired Dr. Nwando Nyoku as the Chief Health Equity Officer, and she focuses directly on patient access, patient health equity outcomes. And then we also hired Mardia Shantz as the Chief Diversity, Equity, and Inclusion Officer. And those two individuals deserve all the credit for the work that we've kind of tackled. One is just implicit bias training. Let's make sure that all the physicians, nurses, techs, doulas, medical assistants have implicit bias training. And then specifically in the ED, 100%, let's make sure the ED has it around using restraints. Just like the other example, there's bias that we don't even know we have. And so really focusing on that, focusing on a DEI strategy, focusing even just on the suppliers and partnerships we have as a healthcare system, and making sure those choices are equitable. And around health outcomes, Dr. Nyoku created the Justice Unity Support Birth Network. And so that's specifically for pregnant mothers of color and of the Native community. And we basically, through cultural navigators and postpartum doulas, really bridge their birth from when they first become pregnant to after they bring their baby home, and guide them throughout their entire prenatal care. And along the same lines, we right now have 3, hopefully we have more cultural navigators outside of that who link the community and people of color and people of different cultural backgrounds who have barriers, and help connect them to our healthcare and to their healthcare so we can bridge that gap. And so those are just a couple of examples. And then the last part, which I love, it actually started from our surgery residency director. He acknowledged, hey, I am not training enough surgical attending residents of diverse backgrounds. And so how do I do that? And they partnered with McCreery to have third-year medical students rotate through the surgery program to get familiar with the hospital, to think about potentially matching here, and also just helping diversify our experiences, our patients' experiences. Patients do better when they see themselves and their caregivers. And so that now has had 12 medical students go through so far, and it's a great partnership. as well. So those are just a couple, but it's like you said, Claire, this could be hours of conversation of what we need to do.
Absolutely. That's fascinating. It's an interesting, I love that way in which you're intermixing, right? The staffing piece and trying to gain some knowledge and insight from a different lens. So that's incredible. Dr. McCreery, any comments you'd like to add?
Yeah, I think this is an area where I felt like our merger between the research and clinical side has been really powerful for our new organization. Fred Hutch has an amazing public health sciences division that was doing a lot of disparities research. There was outreach done for clinical trial enrollment and addressing those barriers. And then we were over on the clinical side trying to tackle the same issues in a different silo. And so bringing together kind of the leaders of those different areas to share ideas and develop comprehensive strategies, I think has been really critical. I would say we also have cultural navigators, which I think is somewhat newer and been incredibly valuable. We were talking to someone else, not from our region recently, and I think they really remarked on, our region is also very unique in the number of tribal nations that surround Seattle, and how we can also be better partners, I think, in serving those communities. And like we call Legacy Seattle Cancer Care Alliance brought with it a relationship with the Snoqualmie Indian tribe on smoking cessation and better lung cancer prevention screening. And so I think looking at how we can build more of those types of programs to better serve our communities is so critical. And then we're really excited about looking at the clinical trials design and opportunities there too, and better compensating people, making the travel to participate in research trials less burdensome. So I think those are things that we're really excited about. And, as a place that trains a lot of PhD students and future oncologists, oncology is an area that has a lot of, it's overrepresented white. And so when people say, like, why aren't you recruiting more people with diverse backgrounds? It's like literally the talent pool isn't there. So I think kind of speaking to what Dr. Simmonds was saying is we need to build those pipelines and programs. And the Hutch has had a wonderful program connecting with high school students and recent college students and showing them about biomedical research and careers in medicine and science that I think we are also continuing to build upon. And so I think this is an area where there's so much exciting things for us to be doing to better connect with our community and build a future workforce that's going to better serve those around us.
Wonderful, thank you. I agree. I think it's all of our responsibility to make sure that the pipeline, so to speak, of people coming into the practice of medicine do come from diverse backgrounds. And I think that's something that we'll need to continue to work collectively on. And how do we bring those different backgrounds to the forefront of the practice of medicine? Love that. All right, well, we have, I think, the luxury of probably one more minute each to go around. I'll finish with a couple quick comments, but since we have a moment, we have one final question, and we'll do kind of a 1 minute each. Sorry to have to do that, but the question is, what do you want to leave people with as they walk away from this conversation? How can we engage? How can the business community engage in and learn from our work? What would be the salient message you'd like to leave this audience with? And Dr. McCreery, we'll start with you since you just finished. We'll go back.
That's great. Yeah. And sometimes I'd actually flip that. I think there's a lot for healthcare to learn from other industries. And so I see, the ability to learn from another and support Seattle that we want to attract and retain staff to is a mutual shared goal, probably for all of us, regardless of the industry. For us, we live in kind of this innovation center in South Lake Union with a lot of biotech, and we're really excited around how we can partner with our business community to drive innovation in our region and continue to advance Seattle's reputation as a place of innovation.
Love that. Dr. Ankeney.
So I think the main thing I would want to leave with the business community that might be listening in on this is hope. This is, I see tremendous opportunities in the future. You know, a lot of the digital changes that are occurring are going to make care provision for people, for organizations and their workforce more able to get care than they ever were before. We are, the healthcare industry is deeply dedicated. You can see from the people who are talking today, just how dedicated we all are collectively in learning ways to better provide healthcare for everybody. That's basically the goal. And I have a lot of hope about where we're headed. It's a time of change, and it's a difficult time because we are dealing with staffing issues, but ultimately I see really bright things on the future, on the horizon for the healthcare industry. So be hopeful. Things are going to continue to get better.
I love that. Dr. Simmonds.
I couldn't agree with both of those comments. I think hope is there. Innovation and collaboration, just by the nature of where we live and the companies that are in our area. But I also agree, let's make our community safe and affordable, right? If we go back to what we first talked about is recruiting in healthcare, recruiting in any industry, the more we can make our city easier to navigate. And I'm going to give an example, is a lot of healthcare workers need to be able to respond within 30 minutes. And if the cost of living is so high within 30 minutes, it's going to be hard for us to get healthcare workers. And so as business owners, business members, how do we make public transportation and access to our communities easier? And I'm speaking specifically to Seattle, but it extends from Everett down to even Centralia, right? Which is not as urbanly dense. So how do we all work together to make our communities a place that we love to live and that's affordable to live in?
I love that. I agree. I'll end with a great big thank you to all of you for your insight. I think just the information, hopefully that'll benefit the business community that will be listening to this. As I said, I wrote a few notes down. There were a few things I thought were really interesting. The one thing I will say again, I think Dr. Ankeney, you mentioned it, which is hope. Each one of us used the words silver lining. So even though we've had kind of a rough patch the last few years, we all feel like there is some sense of hope, a silver lining that we've taken away. I would just say that we need to have these conversations every day about advanced primary care. This is going to be really important to the success of the future health of our community, advocating for affordability, and in truly walking the talk, walking the walk, talking the talk on equity, not just checking off a box, but truly embedding that in everything we do. We've got to continue to emphasize that. And I think at Regence, BlueShield, we're doing that. We do a lot of different work in our community-based organizations, but there's just a tremendous amount more we can continue to advance here. So with that, I think we are finished. I'm going to turn it back over to Vivian.
Sorry, I don't know how to unmute myself either. Those are really great notes to leave on. Thank you so much, Claire, for moderating today. Thank you, Geoff, Brittany, and Arooj for joining and engaging in a really great conversation about the healthcare industry. I was taking some notes too, and I also underlined that there are plenty of reasons to remain optimistic for the future. Before we get going, I do want to say thank you again to our series sponsors, Advanced Professionals Insurance and Benefits Solution and Business Health Trust. We couldn't put in our programming without you. And I do also want to give one last plug for the Seattle Chamber. If you enjoyed the program today and want to get more involved with what we're doing, visit our website at seattlechamber.com to become a member or to check out the great events that we have coming up in the new year. And with that, I'll say thank you again, and we hope to see you all in January.
Thank you, Seattle Chamber.